At the beginning of the CIWA assessment, it asks for a pulse and heart rate taken for 1 minute. For this exercise, we are going to say that the patient's pulse was 101 beats per minute and blood pressure 125/81.
Liz, do you go by Liz?
I go by Elizabeth.
Okay, Elizabeth, my name is Brittany and I'm one of the nurses, and my job is to do a small assessment on you to see where you are at in your withdrawal process from alcohol. Is that okay? Okay. Our first question, have you had any nausea or vomiting?
Oh man, I've been throwing up for days.
For days? What about in the past 30 minutes? Have you had any?
Once.
Once? Okay. And you said several days. How long?
Like 2. I just don't feel good.
Okay.
For the nausea and vomiting question, Elizabeth reports that she has been vomiting for about 2 days, but only once in the past 30 minutes. For this question, you could rate Elizabeth at a 5 or a 6. She has more than intermittent nausea with dry heaves, but it's not to the level 7, which is constant nausea, frequent dry heaves, and vomiting. So a 5 or a 6 would seem most fitting for this.
What about any tremors? Can you hold your hands out straight for me? Do you usually have shakiness in your hands, or is that new?
No.
Okay.
When Elizabeth raises her arms, you can observe tremors to both of her hands, but more noticeably in her right hand. She states that this is a new symptom for her and not something that she frequently experiences. For the rating, a 4 to a 5 would fit here, a 4 being moderate with the patient's arms extended, but it's not to the severe level, which is down there on the scale of 7. So a 4 to a 5 around moderate would be a good rating for this.
What about any sweating?
A little bit. Kind of like the palms of my hands.
Okay.
Elizabeth reports that she has some mild sweating, primarily noting that her palms feel moist or sweaty. So for the sweating category, we would rate her at a 1, where there's barely any sweating observed and her palms are feeling moist.
How about any anxiety? Have you been anxious?
Yeah, because I can't have a drink, and everything's just in my head all the time. I'm just like, I can't sit still.
So would you say that it's severe anxiety, moderate, or mild, if you had to rate it?
At least moderate.
Okay.
Elizabeth can be observed slightly rocking back and forth, appearing somewhat fidgety, and just showing signs of anxiety. She reports that her anxiety is rated at least moderate. So for our anxiety scale, we could rate her anywhere from a 4 to a 5, that 4 range being moderately anxious.
What about any agitation?
No, I'm just anxious.
Okay.
For the agitation category, Elizabeth denies being agitated, and there's no signs of agitation throughout the interview. So for the agitation category, we would rate this at a 0 as normal activity.
Have you had any feelings of itchiness, pins and needles, sensations of burning, or any numbness, or do you feel like you have bugs crawling under your skin?
Good.
Okay.
Elizabeth denies any tactile disturbances. However, you'll note that after being asked about her symptoms, she does begin to scratch and continues to scratch herself throughout the assessment. Rating the tactile disturbances category for this assessment is a little tricky because Elizabeth does deny having any symptoms. However, we do note that she is scratching, so in this category we would rate her a 1. Very mild itching, pins and needles, and burning or numbness.
What about any auditory disturbances? So are you hearing funny sounds, or are sounds seeming louder to you than usual? Okay.
Elizabeth denies having any auditory disturbances. For this category, we will also rate her at a 0 as having none of those symptoms present.
What about any visual disturbances? Is the light seeing
Light
any
really hurts my eyes. It
So
makes
it-
my head, it just makes me want to throw up again.
Okay. It hurts your eyes. Does it seem like the lights are brighter than
Yeah, it
normal?
seems like they're just like burn my eyeballs out.
Okay. Are you seeing anything that's not there?
Not that I know of.
Okay.
For visual disturbances, Elizabeth reports that the light is really hurting her eyes. She denies any hallucinations, so for the visual disturbances category, we could rate her at a 2 or a 3 as having mild to moderate sensitivity.
What about any headaches or feelings
Yeah,
of
my head
fullness in your head?
My head really hurts, like right here.
Okay.
It like throbs.
Would you say that it's severe?
Yeah, and it's
Moderate?
pretty bad. It's pretty bad.
Okay.
Elizabeth reports having a severe headache, pointing to the left side of her head and saying that it feels like it's throbbing, and she reports it as pretty bad. So for the headache and fullness in head category, we could rate her anywhere from a 5 to a 7, being severe, very severe, or extremely severe. If you're unsure how to rate Elizabeth in the headache and fullness in the head category, you could ask her to rate her pain from 0 to 7, and also to possibly elaborate more on the symptoms that she's feeling.
Do you know what today's date is?
Tuesday.
Okay, what is the month and
November,
year?
December. It's December
Mhm.
2nd,
Okay, what year?
2025.
Okay, and do you know where you are right now?
At the access unit.
Okay, perfect.
For the orientation category, Elizabeth is oriented to person, place, and time. She shows no deficits in being able to answer any of those questions, so we are going to rate her at a 0, that she's having no difficulty with her orientation.
So those are all of the questions that we have for this assessment. Do you think that there's anything else that I didn't cover that I should know about?
Not right now. I just feel so bad.
Okay, well, I will talk to the doctor about your results, and we'll see if maybe we could get you something to help with some of your symptoms.
After completing the CIWA assessment, you will add together each category's number for your total CIWA score. For this exercise, your total CIWA score would be anywhere between 22 to 28. For some of the trickier categories on the assessment, where there might be some subjective and objective data that don't necessarily match, you will have to do a little more digging. Dig into the category that you're struggling with rating the most. This will require you asking the patient more questions or possibly observing them for longer, so you're making sure that you truly get an accurate rating.